Okay, I apologize for interrupting. Recent research on vitamin D I think is worth everybody knowing about. We're changing a bunch of new things. We talked about the micro MGB. We're giving away the free iPod. One of the new things we're looking at is streamlining the application process. Instead of 12 steps, we're going down to 7 steps. But there's 2 or 3 new lab tests we're going to be doing, and one of them is vitamin D. Basically, vitamin D is interesting. We kind of thought we knew everything about vitamin D. Vitamin D caused rickets in kids. We added some vitamin D to milk in the United States, and everybody kind of forgot about it because measuring vitamin D levels was impossible, and then it was a research project that cost $1,000 a piece. And now, vitamin D levels are available for pennies as part of standard lab tests. And what we found is not everyone in the United States and Canada is vitamin D deficient, but almost. The number of people that have low vitamin D in the United States right now is gigantic. There's a huge number of people that are vitamin D deficient. And so as part of our pre-op process in the future, we're going to have everyone measure their vitamin D and start on replacement. Now, the findings of low vitamin D are kind of surprising, but the number of people that are vitamin D deficient has been going up. And so recently there was an article by a surgeon as a hypothesis, and it's not for sure, but his hypothesis is that this vitamin D deficiency started, in the 40s and 50s when all of us moved our jobs indoors. And along with that has come our epidemic in the United States and Canada and around the world of obesity. And his hypothesis is that they are linked. That low vitamin D levels might be related to the increased obesity that we're seeing in the United States and Canada. And in fact, there's some good studies where heavier patients who had their vitamin D levels tested had lower vitamin D than heavy patients, which were lower than patients who had normal levels. So that if you draw a regression line, the heavier you are, the lower on average your vitamin D levels are. So there's a big push to look at vitamin D, and I think it's exciting new research on the possibility, is the vitamin D level itself causative or potentially causative of obesity? Stay tuned. One of the things we're sure of is all of us need to get more sunlight. Not to be outdoors and get a burn, but everybody needs some sun every day. And the latest recommendation that I've heard is 20 minutes of sunlight exposing your arms and as much of your body as you can, within limits, every day. And so we certainly recommend that. Our patients can have low vitamin D because vitamin D is a fat-soluble vitamin, and fat absorption is decreased after the surgery. So we strongly recommend regular sun exposure as much as you can within limits every day. And so that's the latest, and we'll keep you updated on some more of the vitamin D research as we find it out. But pretty exciting news. Get out there and get a little sun.